What's going on, everyone? Welcome back to my channel. In today's video, we're going to be looking at 4 exercises for a condition called trigger thumb, which affects one of the tendons for our thumb, a muscle called flexor pollicis longus. So if you notice that you're getting clicking or maybe locking of your thumb, especially with texting or gripping activities, then these will be exercises for you. So again, this condition, trigger thumb, is a condition that affects the flexor pollicis longus muscle, which is one of our thumb muscles, mostly involved in bringing our thumb across our palm like this to reach our other fingers. So if you're involved in activities where you have to pinch things or grip, or maybe with texting on a phone, these can lead to irritation of this tendon. And what will happen is that as it runs up the thumb, it will become sort of locked. It'll get stuck. If it gets more severe, the thumb will get kind of stuck, especially when moving this joint, the interphalangeal joint. People will notice it gets stuck in flexion, maybe stuck in extension. They might hear a clicking in this region. And so there's not a lot of research on this condition, but there are some exercises that are commonly used in physical therapy. So again, we're going to look at 4 exercises essentially to help that tendon glide and move. Besides the exercises, you may also need to consider getting a splint for your thumb, so you can go see a hand therapist and get a splint. And before that, modifying or resting from the activities that are triggering it. So if you're doing a lot of texting, or again, if you're maybe involved in a work situation or hobbies where you're having to do a lot of gripping, repetitive kind of pinching, then you want to try and give those a break so the tendon can calm down and heal, and that will allow it to move more freely again. The first exercise is going to be probably the most important one, and this is a tendon gliding exercise. So what you want to do, because flexor pollicis longus mostly controls our interphalangeal joint, we are going to focus on moving that joint. It does help a little bit with the metacarpal phalangeal joint, so we're going to use an exercise that essentially allows us to move both of those joints through full range of motion. So what you're going to do is go through maximal flexion in both joints, kind of bending both joints all the way the metacarpal phalangeal joint all the way into flexion, and then the interphalangeal joint as far into flexion as you can. Some people will be able to go farther than me. And then you're going to move from there through full extension at both joints. So I get a lot of extension in this joint. A lot of people will just go straight there, but just go as far into extension as you can. And then you're just going to work back and forth. So we're just causing the tendon to glide through its full sort of excursion and range of motion, from full flexion through both joints through full extension in both joints. You may notice that it clicks or pops when you're moving like this. That's okay, as long as you can kind of keep moving through. If it fully gets locked or stuck, then your condition's probably more severe, and this may not be an exercise that's super helpful. In that case, you may need to start with the splinting, like I mentioned, seeing a hand therapist and starting with splinting. You may need to implement anti-inflammatory medication, things like that, to get the tendon to sort of calm down and reduce some of the inflammation, so that you can then implement an exercise like this. For this one, I would recommend doing 10 to 15 repetitions and trying to do this several times throughout the day. Okay, so this is our first exercise, a tendon gliding exercise. For the second exercise, we're now going to work on a movement called opposition, which is one of the most functional movements that our thumb helps us with, this opposable thumb kind of opposition movement, which basically allows us to touch each of our fingertips. So there is going to be a flexion element like in the first exercise, but again, just sort of maybe a little bit more functional in that we're using our thumb in the way that it's meant to reach across to touch our other fingers, essentially creating kind of like a pinch grip with each finger, maybe how you'd hold a key or pick something up off the ground. So again, just work through this, touch each finger, maybe go through 5 to 10 rounds like this, kind of working all the way through. And again, this is something you'd practice several times throughout the day to help maintain that opposition movement, and again, help with the tendon gliding type of movement for this flexor pollicis longus tendon. The third exercise will be an isometric contraction for our flexor muscles and tendons again. This exercise is mainly going to help with maintaining strength in the flexor pollicis longus muscle and tendon. Isometrics also can help to reduce tendon pain, so you may find this to be helpful in terms of reducing pain in the area. You're going to find a ball about the size of like a tennis ball, something like that, that's a little bit on the softer side. And then what you're going to do is just an isometric squeeze. So remember, flexor pollicis longus pulls our thumb across into flexion. So when we squeeze like this, we will be activating that muscle and putting some stress on its tendon. What you're going to do is squeeze like this, and I want you to try and hold for 30 to 45 seconds with moderate pressure. find the level of pressure that doesn't cause more than mild pain. So you don't want to squeeze extremely hard if it hurts. Just find kind of a pressure that's right for you. You're going to squeeze like that, and again, this will help to build strength early on in the muscle in the rehab process, but it can also help to improve the capacity of the tendon and reduce some of that tendon pain. So squeeze for 30 to 40 seconds. This is something you would do 3 to 5 times. You could spread these reps throughout the day or do them all together. But again, pretty simple. Just squeeze and activate that muscle and tendon. When we're letting this area rest, sometimes people will develop weakness. So this will help to resist those changes and keep some of the strength in the muscle and tendon. Our last exercise will be a resisted eccentric, again for the flexor pollicis longus and tendon. This comes from other research on tendons where we see that eccentrics can be helpful again in terms of building strength and reducing pain. There's not a lot of research on the thumb tendon, so we're taking research from other tendons and applying it here. So what you're going to do is you're going to use your other hand. We're going to first put our thumb into flexion, and then what we're going to do is we're going to apply resistance with our other hand towards extension, and our thumb is going to have to fight that. So our thumb flexor muscles and tendons are fighting that, but we're going to allow the other arm to slowly win so that the thumb moves towards extension. When we get all the way to the end, we're going to reset, and then again apply force towards extension so that muscle and tendon are going to get stronger having to do this, and it can help the tendon desensitize. So for this, try and do 10 to 15 reps, and with tendons, when we're strengthening them like this, we'll usually do 3 sets of 10 to 15 reps every day. So you can work through, do a set of 10 to 15, and then later on in the day do another set and just try to get your 3 sets in. Or again, you could do them all in one sitting if that works better for you. So essentially, I put the thumb into flexion across both joints, and then my other hand comes in and creates some force there. My tendon's going to fight it, but allow it to win so that both joints, the interphalangeal joint and the metacarpal phalangeal joint, move into extension through that full motion. Okay, so give that one a try. That is our last exercise. Thanks for checking out today's video. I hope these exercises help you. Just want to mention that my book is available on Amazon and Barnes & Noble. It has programs for the entire body, and each body region has its own chapter. If we go back to the wrist and hand chapter, there's actually this wrist pain program, and it addresses a thumb condition called de Quervain's tenosynovitis. The program could also help with trigger thumb. The nice thing about the programs in my book is that they take you through 3 phases, so they're more comprehensive than a YouTube video. You'll find soft tissue mobilizations to help reduce pain, mobility exercises. Here we have a bunch for the hand and forearm, which can help, since these are part of the kinetic chain, can help the thumb. In phase 2, we have stretching exercises for these muscles and early strengthening. Here's an extensor one for the thumb, and again we have one for the flexor with a different tool here. And then in phase 3, there will be a focus on strengthening exercises for the wrist, hand, and forearm. If you'd like to get a copy of my book, I'll put an Amazon link down in the description. Thanks again for checking out today's video. I'll see you in the next one. Bye.